Hi everyone, thanks Julie. I'm Hannah Robinson. I'm an NIHR 3 Schools Prevention Predoctoral Fellow, bit of a mouthful, based at Bristol, and I'm really glad to be presenting the Forest study today, which is looking at supporting educational and youth organisations to deliver self-harm and suicide prevention and postvention. As you can see, we've got a large research team, and we're gratefully joined by Lizzie Mitchell, who you met earlier, who's been really involved in qualitative data analysis and supporting young people's advisory group sessions. So Charlotte really kindly set the scene, I guess, earlier for youth mental health, but just to add some self-harm and suicide statistics, it's unfortunately, as I'm sure many of you are aware, pretty prevalent in young people. So we've got by the age of 17, 24% of young people have self-harmed and 7% have attempted suicide. And then more recent data, albeit in a slightly older age group, has even higher reported prevalence. So with this in mind, there are gaps in the evidence around approaches to prevention and responses following a suicide, and also around the provision of support within schools and community settings. So there can be concerns around sort of potential harms around talking about self-harm and suicide, and this is something we hear particularly from education staff, but this we know can be a barrier for young people accessing support in these settings as well. So I'm just going to give a brief overview on what we've done in the project and where we're currently up to, and then I'm handing over to Liam, who's going to share some findings with you. So phase 1 of the project was all about scoping current practice relating to self-harm and suicide prevention and response, and to prepare and develop plans for phase 2 of the project. So to scope current practice, we did an online survey of secondary schools and colleges to see what policies they had around self-harm and suicide prevention and response, and what sort of activities they do or methods they use in this support. And we also did a scoping review of current guidance available to schools and youth organisations around self-harm and suicide prevention and response. So these are waiting to be accepted by journals, the papers of these, but we've co-developed infographics with our Young People's Advisory Group, which you can find through that link. So phase 2, we scoped current practice in phase 1, and phase 2 is all about how to strengthen the support provided to education and youth organisations around self-harm and suicide and response to death by suicide. So our main objectives are to gain understanding of the experience and support needs of those giving and receiving support in schools and other youth organisations, to explore inequalities in the support received, and to identify ways to strengthen the support. Ultimately, the aim is to co-produce principles of practice for organisations regarding self-harm and suicide prevention and response to death by suicide. So to address sort of the objectives 1 to 3, we've completed qualitative research. So we spoke to professionals or volunteers and organisations that either deliver or receive support around self-harm and suicide in young people. So that's what Liam's going to be sharing findings about later. And we also spoke to young people aged 14 to 21 with lived experience of self-harm, suicidal ideation, or experience of a death by suicide. And we focused our recruitment, but we didn't limit our recruitment to the 4 areas that you can see on the screen. So we're currently finalising our themes from young people data, so I unfortunately can't share with you today, but we spoke to 74 young people, mostly in focus groups, but we did offer one-to-one interviews for 20 young people, and you can see that they had a range of either experiences and demographics as well on the screen. On to the Delphi study. So the Delphi study is addressing that objective 4, so using consensus methods to co-produce principles of practice for organisations regarding self-harm and suicide prevention and response to a death by suicide. Some of you may be familiar with Delphi study, some may not, but we've got 3 panels of participants, aiming for 30 in each. So we have professionals who provide suicide or self-harm prevention and or suicide response support to schools and other youth settings. We've got school, college or youth setting staff working with young people, and that includes voluntary workers. And then our third panel is academics and clinicians who specialise in youth suicide, self-harm prevention or response to suicide. So Delphi study consists of 3 rounds of questionnaires sent to those 3 panels I just mentioned. So panel members anonymously comment on or rate the importance of those statements for inclusion in the principles of practice. So if they thought that statement was really, it has to be included in the principles of practice, that would be a 4, so strongly agree. And if they didn't think it was important, that would be a 0. We also have open-ended questions to gather free text responses, which will be analysed and can be used to generate statements for the next round of the Delphi study. So our consensus threshold is 75% extremely important or important, and the progress statements will be included in our draft copy of Principles of Practice, which we will be sharing and discussing with our advisory groups, but I'll talk about that later. So we're analysing responses from round 1, which is exciting, and we're now developing our round 2 survey content to be sent out. So public involvement. I'll start with our Young People's Advisory Group. So it's been going since the start of the project, and we've got 5 or so active members. But excitingly, we've got 3 new potential members who Rowan from Exeter has recruited via Snapchat. So I'm sure he would be welcome any questions around recruiting via Snapchat. But yeah, I spoke to 2 of them last week and they seem really keen and engaged to be involved. So that's really great. And we met recently as a group and shared findings from adult interviews that you're going to hear today, and also discuss content for Delphi round 2 survey around stigmatising myths or beliefs around self-harm and suicide. We also have a Parents Bereaved by Suicide group, which I think was established last year or so, and there are 5 or so active members. And again, the most recent session was discussing findings from the adult interviews, and their views are informing Delphi round 2 statements as well. And then as well as this, we've got our professional advisory group who have a variety of relevant roles to the topic. We have lost some members due to capacity because of their professional roles, but they have participated in Delphi round 1, and we're looking to pick this group up with a session soon. And as I mentioned earlier, once we have our draft principles of practice from the Delphi study, we will be taking these to these groups to get their feedback, advice on near-miss statements, so those that almost reached consensus but didn't quite, and ultimately sort of approval before dissemination. I think that's me. Okay, we're over to Liam to share findings from interviews with adults.
Brilliant. Thank you, Hannah. My name is Liam Spencer. I'm a research associate based at Newcastle University, and I'm really pleased to be able to share some of our qualitative findings with you today from the 4S study. And I'm going to be focusing on the adult participant data analysis, as Hannah said. So this is our data from our professional stakeholders, which Emily Widnell and I have been working on. So I'll give you a quick overview of the sample and then move on to the main themes that we've developed through our framework analysis. And then finally, I've got some participant quotes to share with you to give you a kind of sense of how these themes came through in people's own words. So this is really a bit of a snapshot of where we are in the analysis and what we're learning so far. So as you can see there, we spoke to 33 adults in total. So that was 28 individual interviews and 1 focus group with 5 participants. And we had a really good range of roles represented across education and youth settings, people like teachers, safeguarding leads, youth workers, senior managers, as you can see there in the table. And our questions focused on how these stakeholders respond to self-harm and suicide amongst young people, what kinds of support they access, what they feel works well, and where the barriers are. We were also interested in their perceptions of how joined up systems are, things like relationships between schools, CAMS and other local services, and what helps or hinders an effective response. Next slide, please. So we have taken a framework analysis approach. We've generated 6 main themes, each with several sub-themes underneath. So I'll just run through those quickly with you now. And the first theme is around strengthening knowledge, communication and training. So participants often described a lack of confidence or clarity about what to do when a young person self-harms or expresses suicidal thoughts. The second theme focuses on systemic gaps and barriers. So there was a really strong sense that services often operate in silos, which can make joint working really difficult. Our third theme looks at role ambiguity and gaps in responsibility, particularly around thresholds. So when does a case sit with the school versus when does it need to get referred on, and what happens in between? Our fourth theme is around fear, shame, and stigma, which covers some of those persistent myths around suicide and self-harm. One of the things that came up a lot was around, if we're talking about it with these young people, then we might make it worse, or just avoiding talking about it altogether. Our fifth theme looks at social and community context, so recognising that young people often turn to their peers first, and that adult responses sometimes don't actually take that into account. And then finally, our sixth theme is around specific response needs after a suicide. So looking at how schools and youth settings manage that aftermath, the communication, the curriculum, the language that's used, and the challenges that come with it. Next slide, please. So yeah, just to give you a bit of a flavour of how our participants describe some of these experiences, I'll share a few quotes with you that are on the screen there. So one of our participants said, just a lack of knowledge, just us not knowing what to do. People want to do the right thing, but they're terrified of getting it wrong, which really captures that first theme around their own confidence and the level of training that they've received. Another said there's just no link up sometimes, like the schools, CAMS, the local authority, we're all in our own bubbles, which speaks directly to that theme I mentioned around system fragmentation. And then this quote where it says, but I guess that's a difficult thing, which is thresholds. When are they risky enough to get support, but not so risky that we can manage it ourselves? So that tension between responsibility and risk was something that's really come through in our data. Next slide, please. So we've also heard really powerful reflections about stigma and cultural narratives. So one person said that the biggest myth I come across, it's rife and everywhere, is don't talk about it or you'll plant the idea. That's still deeply embedded. Another participant highlighted that importance of peer relationships. So I think what adults specifically, to answer your question, what we often miss is that young people talk to each other long before they talk to us. And finally, this quote here points to that postvention challenge. So I think a key area for us would be not about just the crisis response, but also how we manage the school environment after, what books are in the curriculum, what language we use. So overall, what we're seeing is a lot of commitment and care from professionals in these roles, but also a real need for more support, clarity, coordination to help them best respond effectively and confidently. So myself and Emily are in the process of writing up the narrative around these findings. We're of course really keen to connect them back to the wider 4S study and its implications for training, policy, and system design moving forwards that Hannah touched on earlier. So thank you.